Hi, my name is Kristen Kilpatrick, and I am an FNP student at Maryville University. This is Lori, and she agreed to be my patient today for this neurological exam. I'm going to go ahead and test the cranial nerves, so go ahead and close your eyes. Cranial nerve 1 is olfactory. I'm going to occlude one nostril and go ahead and tell me what you smell.
Cinnamon.
All right, great. Cranial nerve 2 is optic, and I'm going to go ahead and use the Snellen chart. I'm going to stand 10 feet away and read the bottom line that you can see.
O-R-Z-S-K.
Okay, and that was 2020. That was the bottom line. All right, I am also going to go ahead and assess the pupils. Go ahead and look forward. All right, they constricted, and they also were consensual. All right, great. Cranial nerve 3 is oculomotor, 4 is trochlear, and 6 is abducens. I'm going to test this with the 6 cardinal fields of gaze. And so go ahead and follow my finger with just your eyes. All right, great, and she did that great. I already tested the pupils. Cranial nerve 5 is the trochlear, or trigeminal nerve, sorry. And I'm going to go ahead and have you clench your teeth. I'm going to feel the muscles. Clench them. Okay, good. Cranial nerve 7 is facial. Go ahead and smile. Go ahead and frown. Close your eyes tight. Don't let me open them. Okay, raise your eyebrows. Puff out your cheeks. And show me your teeth. All right, great. Cranial nerve 8 is hearing. And first I'm going to do the whisper test. Go ahead and close close that ear. Tell me what I'm saying.
1, 2, 4.
All right, and again.
7, 8, 10.
All right, and I'm going to do the Weber test next. Tell me if you can hear it both in both ears.
Yeah.
All right, I'm going to do the Renee test. Tell me when you can't hear it anymore.
Now. Now.
All right, I'm going to do it on the other side.
Now. Now.
All right, great, and air conduction was twice as long as bone conduction, which is a normal finding. I'm going to go ahead and do cranial nerve 9 and cranial nerve 10, which is glossopharyngeal and vagus. So go ahead and stick out your tongue. All right, and I would test the gag reflex at this time. It's not normally tested unless I thought it was going to be abnormal. Cranial nerve 11 is spinal accessory. Go ahead and shrug your shoulders. Okay, look to the right against my, there you go, look to the left. All right, cranial nerve 12 is hypoglossal, so go ahead and stick out your tongue, stick it from side to side. Great, and that was the end of all the cranial nerves. Next, I'm going to test rapid alternating movement, so put your hands on your legs and go upside down and back, okay, slow, and then do it rapid, more rapid. All right, and that was, she had smooth movements, and nothing abnormal about that. Next, I'm going to do finger to nose, so put your finger to my finger and then to your nose. All right, we're going to do heel to shin, so right heel on your left shin, and go up and down. And the other one. Good. I'm going to test her balance with the Romberg test. Go ahead and stand up. Heels together. Okay, close your eyes. I'm testing to make sure that she doesn't have a ton of swaying movements. A little bit is normal. Go ahead and put your arms straight out, eyes closed. Great. Go ahead and open your eyes. I'm going to go ahead and test your gait, so go ahead and take a little walk around the room. All right, and that was good. Okay, next I'm going to test your primary sensory responses. So close your eyes, tell me where I'm touching you, when I'm touching you, and if it's light or if it's sharp or dull.
Sharp. Right arm. Dull left arm. Dull right leg. Sharp left leg.
All right, and that was great. Next, I'm going to do vibration. Close your eyes and tell me where you feel me this vibrating.
Left toe. Right hand.
Okay, and I'm going to test her sense of, her perception of sensation. So go ahead and tell me if I'm pushing your toe up or down.
Up, down. down.
All right, great. I'm going to do stereognosis next, and go ahead and close your eyes. Hold your hand out, and I'm going to introduce a familiar object. Feel it and tell me what you think it is.
It's a coin.
All right, that's great. I'll go ahead and take that back, and I'm going to do 2-point discrimination. So with your eyes closed, hand out, tell me if you feel 1 point or 2.
1, 2, 1, 2, 2.
All right, and that was great. Here, let me do the left leg too.
2.
All right, great. And I'm going to do graphesthesia now. And go ahead and close your eyes. Let me see your hand. What am I writing on your hand?
A B.
All right. And tell me where I'm touching you.
My right arm, my left leg, right leg, left arm.
All right, and I'm going to go ahead and head on to the reflexes. So if you want to go ahead and lay down, I'm going to use my reflex hammer. I'm going to use the end of my reflex hammer to test the abdominal reflex. I'm going to stroke away from the umbilicus. And then I see the abdominal muscles contract towards the where it is being stroked. Great. Go ahead and come on up. And if I did have a male patient, I would do cremasteric reflex, where I stroke the inner thigh and the scrotum will go towards the area that's being stroked. Next, I'm going to go ahead and do the plantar reflex. Do both sides. All right, and that was great. I'm going to go ahead and do the deep tendon reflexes. I'm going to do the tricep ones first. Go ahead and relax that arm. All right, and do the biceps. Relax, relax. All right, do patellar. And I'm going to do Achilles. Okay. And lastly, I'm going to do ankle clonus. All right. All right, and I didn't see any abnormal movements. And that is going to be the end of my neurological examination with Lori, and thank you for viewing.